Hello, urgent care folks. This is some clinical indications why patients coming in with acute abdomen, and we want to differentiate to make sure that we triage them appropriately and make sure they go to the right place and get treated immediately and get them better. So let's understand these appendicitis signs by introducing the signs associated with appendicitis, providing a fundamental understanding of this topic. We want to talk about the morphine sign. This session will focus on the morphine signs, the key indicator of appendicitis, often associated during physical examination, and other key signs. We will explore additional signs such as the McBurney signs, the SOR signs, the Rover signs, and obstructed signs, detailing the significance of these signs. The presentation will conclude with a summary key points and discuss regarding the appendicitis and its signs. So what is appendicitis? When we say appendicitis, it's an inflammation of the appendix that often leads to the surgical emergency if not treated promptly. This could be deadly. Seen a lot of patients coming in, even children, and they come in with, you just kind of know something is wrong. So common signs of appendicitis include abdominal pain, nausea, vomiting, and fever, which helps in the diagnosis. Very, very key indicator. You got to pay attention. Those little low-grade fever, don't just rule them out as nothing a possible UTI. You want to really palpate this abdomen and make sure and look at the patient reaction when you're doing that. So it's the importance of this early diagnosis. Early and accurate diagnosis is crucial in managing patients with acute appendicitis. You do not want to miss that, because appendicitis can get ruptured. The appendix can get ruptured, and then it's not a good thing. So let's look at the Murphy sign. Again, sometimes we have these patients coming in and really coming in and they're saying, oh, my stomach hurts, I'm just a little nauseated. But we got to really assess this abdomen. So Murphy sign is a clinical test used to assess for gallbladder inflammation during an abdominal examination. So the examiner palpates the right upper quadrant while the patient takes a deep breath, looking for the signs of discomfort. Sometimes we call it a respiratory cessation on palpitation of the right upper quadrant. That kind of give you, say, okay, something is wrong. A positive Murphy signs indicates potential gallbladder issues. So these patients need to be going for diagnostic evaluation immediately. You see that you put that right upper quadrant ultrasound stats to make sure the patient going. If you don't have that in your facility, you want to send that patient to ER for further evaluation, because you never know if this patient is going to end up in the OR that night. So depending on if it's really inflamed or badly inflamed, but again, you do not want to just let that patient go home. So there's a lot of reasons why we do what we do, right? So what is the significance of Murphy sign? Murphy sign is primarily used to identify gallbladder inflammation, helping to diagnose cholecystitis. So, I mean, the gallbladder is inflamed, it needs to come out, does it not need to come out? So we got to make all those clinical decisions for this patient. Although primarily linked to gallbladder issues, Murphy signs can also assist in diagnosis in appendicitis. Need for further evaluation. A positive Murphy sign may indicate a necessary additional diagnostic evaluation or medical intervention right away. So talking about it, we got to CT the abdomen, we got to ultrasound that abdomen to make sure, and get some labs. Your white count is very important at this point. Let's look at the McBurney's point. Location of the McBurney's point is defined as one-third of the distance from the anterior superior iliac spine to the umbilicus. So clinical significance of the tenderness at the McBurney's point during palpitation is a key indicator of appendicitis. Can't miss that. So signs of appendicitis, and clinical relevance of the McBurney's point. Let's look at the tenderness at the McBurney's point. Is a classic indicator of the appendicitis in patients with abdominal pain. Mostly they're always acute abdomen, so you really don't want to miss that. So, and the location of the McBurney's point, again, located at the right lower quadrant of the abdomen, crucial for diagnosis, very important. You got to take those clothes off. You got to palpate this abdomen and first listen to the abdomen. Sometimes the bowels are quiet. So the clinical assessment tool, understanding the Margoni's point, enhanced clinical and patient clinical presentations with the abdominal issues. Very, very important. Tell them, look at the stomach and look at the abdomen and look at everything. Listen, and palpate, and you don't want to miss it. And so you can triage the patient appropriately. If they belong to you, is if they need to go higher level of care. Maybe they're going to OR that night. Who knows? Because I gotta share this story. I have how old was this kid? Or about 6 or 7. It's coming in with mom with abdominal pain from school. They think it's viral gastritis versus whatever. But just looking at this child, when I see his abdomen, he has epicolis. So that's kind of an indication that with the appendix. So that's an indication. So we had to send a child to Children's Hospital, possible for appendicitis that night. So let's look at the SOAS signs. Okay, the SOAS signs is tested extending the right hip or flexing it against resistance. Assessing the muscle irritation, again, indication for appendicitis. Pain during the SOAS sign test indicates possible irritation of the psoas muscles right there, and often associated with appendicitis. So understanding the psoas muscle anatomy is crucial for interpreting the signs and positive based on clinical presentation. Because you got to look at your patient. The story they're telling you will help you get a good assessment and help them and better give them what they need, so you don't miss it. Let's look at some of the importance of SOAS signs. So the SOAS sign is a clinical indicator of the retroceliac appendicitis, suggesting a specific anatomic concern. So a positive SOAS sign enhances the suspicion of appendicitis, heading to a diagnostic process. So again, though you're going to CT, but your physical assessments are important. So recognizing the SOAS signs is critical in guiding the further medical intervention. Very, very key, and you don't want to miss it. So let's look at the Robin sign. Okay, Robin sign is assessed by palpating the left lower quadrant of the abdomen. Okay, it's the left lower quadrant. Remember, Robin sign is the right lower quadrant, so this is the left lower quadrant. And lumbar tenderness or pain on the right lower quadrant may indicate appendicitis during the assessment. Okay. Robin's sign is a key indicator for diagnosis of appendicitis in clinical examination. So you gotta feel the abdomen. So positive Robin's signs suggest that applying a pressure on the left abdomen, increasing pain on the right side. Left abdomen, right side pain. The presence of Robin's sign can reinforce the clinical suspicions for appendicitis, because you got to treat people based on clinical presentation and their physical assessment. You got to look at those patients, and based on your good assessment, you nail it. Look at the obturator signs. To test the obturator signs, flex the right hip and knee, then internally rotate the hip. Pain during the abductor sign may indicate irritation of the abductor internal intrus muscles, commonly associated with appendicitis. Understanding the abductor signs is important for diagnosing condition like appendicitis. So let's look at some clinical application of obturator signs. The obturator sign indicates irritation of the obturator intrus muscles due to inflammation of the pelvic region. Again, straightforward. Although less common, a positive obturator sign can support the diagnosis of pelvic appendicitis. But again, you're gonna get a CT abdomen, but you get at least to give you some indication with all the other stuff you've done. The clinical presence of the apparatus signs can guide clinical decision making, and about the patient and management and further investigation to get your CT. And I mean, you can document this in your notes. So I mean, you're not gonna get, when you're in the urgent care ER, you're not gonna get rejected for CT abdomen pelvis. They gotta do it because the patients have an acute abdomen. They have no choice, so they do it anyway. It's not like we're running it through the insurance. The ER or the urgent care, you gotta do it. Let's conclude this and wrap this up with some, try to make this note simple and short and sweet as much as possible so you get the point of it. So the importance of diagnosis: timely diagnosis of appendicitis can significantly reduce the complication and improve patient outcome. And clinical signs of recognition: recognizing the clinical signs of appendicitis is the clinical provider in making informed decision regarding where to take the patient, versus like, okay, do I just send this patient home, versus you just kind of know, I mean, this patient is not a patient that needs to be discharged home. It needs further investigation, or you send him to general surgery, or whoever is going to do the surgery, or call somebody else to look at them. Each sign of appendicitis provides clinical information of image managing these patients. And you do not want to discharge somebody home and have a perforated appendix when they get home, and that's not looking good. You just saw them. How did we miss this? So again, thank you for listening, and if you want like more videos, let me know. I will be presenting more other topics. Thank you.